Who are we expecting, Tori?
We are expecting, we have a total of
Jessica Krantz and Caroline Cruz. And I'm assuming that's Pam.
Yes.
I'm Tony.
France is coming in now. There she is. Welcome,
Hello.
Jessica.
Hi,
How are you today?
doing well, and yourself?
Oh, I'm living the dream.
What dream is that?
It's the nightmare I call my life. No, I'm just kidding. I'm kidding.
You woke up and you were the executive director of the, yeah, okay.
It almost was like that, but we'll save that story for another time.
awesome. Well, we're just 1 minute in, so we'll give her a
Couple minutes.
couple minutes more.
Okay. Does anybody have a joke? No jokes, okay.
Tony, did Coat ever get back to you about specifically who would from ODE participate?
I have a meeting scheduled with them, which they gave me some times. It's next week at 3:30. Want to come to it?
Thank you, though.
I'm meeting with Colt and I think 2 or 3 other people in his staff. I suspect that they are anticipating that we'll tell them that they have more things we want them to do. I'm hoping that I can convince them that if we're successful, we will actually help them get their goals achieved. We'll see what comes of it.
And
Go
what
ahead.
about the person from the family?
Yeah. Her name is Valerie Vargas, and she's at the Ford Family Foundation, and that's one of 4 foundations that have created the Oregon Parenting Education Collaborative. I know you know that, but I thought I should brief everybody on it.
Yeah.
I think that's Caroline. It is Caroline. There she is. Hello.
Good afternoon. So everyone who was invited is now here.
So let us begin.
Again.
I got some slides. May I show them?
Sure.
Okay. So our assignment, should we decide to accept it, is to address the major family risk and protective factors affecting child and adolescent substance use through evidence-based family interventions. And so that is our assignment. Is everybody comfortable with that as their assignment? Anybody want to comment on it in any way? Okay. So here's the agenda. Tori sent it out to you. I think she's going to address communication among work groups, and then we'll get into the substantive things. Is that fair, Tori?
Yes. Thank you guys for being here. So a question came up in regards to communications and what type are appropriate amongst our work group. As you guys know, we must follow public rules in regards to our meetings. And so a question came up in regards to how we can communicate with one another. And just so you guys know, it's perfectly fine to send information directly to each other, resources, things of that nature. However, discussion and decision making must be in a public forum such as this one. And so we ask that you refrain from that type of communication or dialogue amongst each other. Any questions in regards to that? No? Okay. Moving forward, my goal is to get the agenda out to you guys at least 3 days prior to our meeting. Give you an opportunity to let me know if you want something added or if you have questions about what's listed, things of that nature. Because as you guys know, again, because this is a public meeting, we have to post it on our website to let the public know that we are meeting, when we're meeting, and the topics we'll be discussing. Last but not least, I just recently learned in a law summit that I'm also participating in, we have to be cognizant that we don't go outside of that agenda. I know, we get excited and sometimes other topics come up that we want to discuss, but we could be in violation if we discuss things that are outside of what we published in regards to what we'll be discussing.
Well, we have on the agenda the ability to always modify the agenda, so we don't have to stick directly to just the topics that are on the agenda, which is why that little statement is on there, so that we've already declared that we may or may not stick to the agenda, so that we are okay with that piece of the public meeting rules.
Awesome. So that's the conclusion of my discussion in regards to communication. Did anybody have any questions?
Okay.
All right. Well, you can take it from here, Tony.
Okay. Well, let me, I don't know, you got a lengthy paper that summarizes kind of what we know about family well-being, both the things we're concerned with here and broader issues. And I wonder if you've had a chance to read that. I'm sorry if it was too long and turgid, but it was the best we could do. So, this is a place that I think something I want to say. I said this to whenever I give talks about substance use. We can't prevent substance use simply by targeting that problem. To prevent substance use and substance use disorders, we have to prevent all of the psychological and behavioral problems that are risk factors for substance use. The good news is that if you prevent those, you're going to prevent substance use as well. So to do that, we need to ensure that our young people live in environments that nurture the development of all of the psychological and behavioral skills that people need to thrive. And so this is a figure that's very similar to the one that was in that paper that I sent you, that's basically summarizes 40 years of research on the factors that lead to drug use and all of these other problems. Children who are raised in coercive social environments, both families and schools, are significantly less likely to develop good self-regulation. They're more likely to develop aggressive and uncooperative behavior. That, when they get to school, leads to increased likelihood of academic failure, increased likelihood of being rejected by their peers. And by early adolescence, we see that these kids who have been rejected by their peers and aren't doing well in school meet other kids who are rejected by their peers and not doing well in school, and it's magic. They become friends, and they start to basically reinforce each other's problematic behavior. And that is what's been called the training ground for the development of antisocial behavior, depression, drug use, and also early child rearing. And that there's an evolutionary reason for that. When children are raised in a threatening environment, living in a threatening environment, having your babies early makes it a little more likely that your genes are going to survive. So it's an evolutionary process. And this graph also shows that these kinds of environments are directly connected with increased cardiovascular disease. And the reason that's important is because currently our healthcare system spends a lot of money on treating problems that could have been prevented. And so the prevention work that we're doing, I think, has the potential to increase health and reduce premature death and cardiovascular disease. And the other thing about this is that poverty and discrimination are important contextual factors for these problems. So that's sort of my summary of the developmental pathway that leads to substance use and related problems. I don't know, do you have any thoughts or comments or feedback on that? Can I ask you specifically, or Jessica, do you have comments on that?
I don't have specific comments other than it seems like this is one main pathway and that other pathways exist, and so it may be important to think about those other pathways as well and as we do our planning and coming up with recommendations for strategies.
Do you want to mention those?
So social modeling of parental behaviors. I'm thinking about folks who come maybe from different contexts. And again, I'm thinking of this through the viewpoint of college students primarily, who may see older siblings or parents using drugs or alcohol in a particular way, or may, be influenced by different media. To basically have expectations for alcohol,
right,
specifically, and how it's going to affect them, those types of things.
Thank you. Caroline, thoughts about this?
Well, I just want to make sure that when we're looking at the total picture of prevention, that we're going through the whole lifespan. And I understand that, this fast developmental pathway, but I'm still concerned about, those who might be like prenatal as well as the elder population, because we tend to make a reversal as folks become more chronologically privileged and their body chemistry begins to change. They have other type of impacts that are impacting them, other type of risk factors. So I know we have to begin somewhere, but I still want to make sure that we just don't maybe focus within the school system, that we also look at the community.
So your concern is that, and I think this came up in our strategic planning process, that there are family issues that go beyond the raising of children that can involve people in substance use, and we need to address what kinds of family programs might be relevant to the risk factors you're alluding to. Is that a reasonable paraphrase?
Well, my background is on a lot of the risk protective factors that was developed by Hawkins and Catalano.
Yep.
And so my solid background is more comprehensive, and then just dealing within the family domain.
Yeah. Right.
And so I just want to make sure that we're able to look just beyond one domain, and that we address the other areas as well as how, a lot of the risk protective factor research was done prior to the adverse childhood experiences and the social determinants of health, even though I know how to blend that in. I'm looking in terms of, well, we're going to set standards for the whole state. And what type of training is going to go along with all that. That's just not maybe from working within a family, or probably just dealing with maybe one major curricula.
Well, one thought is that this work group is focused on families, but I take you to be saying that that may need to be broader than what I'm talking about here.
Yes, Because
Okay.
this is the only prevention work group that I know of. Is there others?
There will be, with any luck. So Pam, do you go by Pam?
Yes.
Yep. Comments on this?
Yeah, kind of piggybacking on what Jessica brought up, especially with regard to families. The genetic component of understanding substance use disorders is important. And that's the piece that, I mean, genetics don't change, we can't tweak them, but if we understand them and our genetic vulnerability, then environments are, that's the piece that we're able, I guess, for lack of a better way of describing it, manipulate. And so, social norms and exactly as Jessica said, college, right. The college environment.
Well, actually, there's recent evidence that genes expression is affected by social environments. So in fact, we can affect gene expression by helping to ensure that kids are in warm, nurturing families. So
yes.
Okay. So I got a couple more slides. There's a paper by Leslie et al., which included, by the way, David Hawkins, just so Caroline knows. And what they were focused on was what family interventions are available that could be provided by healthcare providers. The paper was intended, and this was the National Academy of Science was trying to do this, and they have been working on trying to get to reach families with family interventions through the healthcare system. So the Leslie et al. Paper was making the case for why that's a particularly good channel to reach families. And while I agree with that, I think as a pragmatic matter, anything that'll help us reach families would be good. And so this is just, these two slides are just a list of 16 family interventions that they identified that have been shown in typically multiple randomized trials to significantly reduce the risk of substance use and all kinds of related disorders. So there are maybe a few other programs that I've identified, but this is just by way of saying that there's a wealth of programs that are available, and many of them are being implemented in Oregon. And in fact, at least 3 of them, the ones in green, were developed in Oregon. And in fact, research at Oregon Social Learning Center was seminal in the development of most of these family interventions. All of them basically work by helping parents to become more patient, to become more consistent, to become more positive in their interactions, and to make less use of aversive means of trying to deal with their kids' behavior. So this is just by way of saying that there are these programs, and I don't know, and I'm not sure who knows to the extent to which they're reaching families in Oregon. There are other risk factors, by the way, that are less effectively addressed through family interventions, things like poverty and homelessness and so on. But that's a bit beyond the scope of our work. So I took a crack at what might be the key questions that we might ask, and I'm not sure which to say first. I reached out to, I was starting to talk about this early, to Valerie Vargas, who is works for the Ford Family Foundation. And the Ford Family Foundation and 3 other foundations have created this Oregon Parent Education Collaborative. And for the last 11 years, they've been working on trying to strengthen the availability of family interventions. She briefed me on 2 other people that she thought might be helpful to us, who are doing research on the extent of the family system in every county. I don't know very much about what they know, but I think they're an essential resource that we need to reach out to understand what's going on. I also don't know to what extent the state's public health system is on top of what's what's available and how well we're reaching families. But so these are the key questions that I thought we need to address.
So Tony, if I could interrupt before we go into the key questions,
Yeah.
just to take the pulse of other members, work group members. Do you guys have any questions in regards to what you learned about the evidence-based family interventions that are currently available?
Thank you. Good point.
It's nothing new. You've heard of these before.
Yeah, many of them are ongoing at the University of Oregon, specifically in the Child and Family Center, and others in other parts of the university.
Awesome. Pam, you're about to say something?
No, nope.
Okay.
Okay, just wanted to give everybody an opportunity if they had any
Thank
questions about the others before we go into the next topic. Okay, Tony, go right ahead into our question.
So it seems to me that the fundamental, if you think, well, 5 years from now, we've made tremendous progress on this issue. Well, I think that if that's were the case, it would be that families who would benefit from these programs were routinely being reached by them. So I think one of the things we need to know is, what's the system in the state, and it's going to come down, I think, to county or regional questions. The OPEC Oregon Parent Education Collaborative has defined regions that often have multiple counties in them. So we need to answer this question. The first one is, what systems are in place that enable our communities and counties to reach families with these kinds of programs? But my question is, are these the key questions? What do you think? Do you want to take them one at a time, or do you want to just read them and discuss?
So if I could also add to it, when we say key questions, are we saying these are the things we will work to answer as a work group moving forward?
Well, when I say key questions, question mark, my question to this group is, are these the questions? And I don't, that's fundamentally up to the work group.
Okay. I think my question is, so if the answer is yes, which we haven't gone through them yet, then we will move forward with utilizing these questions as our, if you would, work instructions for the future.
Yes.
These will then be the things we will work to answer.
Exactly.
Right? So that's the outcome that we're looking for when we say, are these the correct questions? Are these the things we will then work on moving forward as a work group?
Well said. So, can I call on you to comment? You want to? Let's just take the first one. All right. Is that something we need to get on top of? Not saying how we would, but if it's something we need to answer, then we'll begin to figure it out.
Yeah, I think so.
Okay. Jessica's nodding.
Yeah.
Caroline?
There was a time where we could answer these questions. I'm not even sure what mechanism. We don't have any structure within the state any longer, I believe, in terms of prevention. I think we're all over the map.
I think you're right that we're all over the map. And I just discovered yesterday that ORI has an associate scientist who just was appointed the head of public health for Washington County. She described what they're doing, and it sounded like she might be able to do this. And I thought of you, Caroline, because you're absolutely right that this would have been the responsibility of the people, the prevention people in each county, and that system got eroded. I suspect that Oregon Health Authority would say that it's the public health authority in each county that has this responsibility, though I don't know that. But it is an issue.
I think we have public health programs within each county, but the public health are not the ones who are doing if you follow the funds, they're not the one who's running the prevention programs. I think every county, we would have to do, and I'm not even sure, because if you even ask this question, who are you going to go through? I mean, who's?
Well, and this came up in our previous meeting that where Dwight, raised this issue, and I think the question is who in a county or in a region, if they're organized by region, is dealing with this issue. And you may be right, because I know that when things went over to the Oregon Health Authority, they had a sort of a public health orientation that was more focused on policy, and they were more skeptical of programs. So, these are questions I think we need to explore.
I think it's important for us to know what's happening in the state.
I agree.
So I agree
Right.
with the question itself, that I think it's important for us to know what exists.
Okay. So we're pretty much agreed that this is one of our assignments. Yeah. Okay. So the second question is, what programs are in use to assist families, both family programs and other forms of assistance? I think I had a discussion earlier with Dr. Richardson about this, and I think, tell me what you think, Reggie. I think you're saying we should restrict this to family programs that are designed to deal with family relationships, family issues related to substance use, and things that would make substance use more likely. Is that a fair statement?
Yes, that's accurate. I think that's within the scope of the Alcohol and Drug Policy Commission, and thus the scope within the subcommittee. All the various components that go into making folks vulnerable to substance use disorders are important, but we have to limit, I think, our focus to those family-based programs that are directly tied to substance misuse.
I'm revising this accordingly.
But that's my view, and I'm not dictating that view amongst other members, but I'd be very interested to hear what the rest of you think about that.
I think it's realistic that we need to connect it, since this is an Alcohol and Drug Policy Commission committee, to start looking at prevention. So I don't think it's unrealistic. However, if programs are doing programs the right way, not only should a good program address substance misuse, but it should also address other problem areas.
Yes.
Like teenage suicide, delinquency, violence. And so I do believe that we have to stay within the alcohol and drug.
Right.
Yeah.
Well, fortunately, all of these programs have benefits that addressing these other issues as well. So,
yeah. I agree with you, Caroline, so very much. I mean, if I was king for the day, we would focus on poverty.
Yeah.
Because I think all of these other things can be resolved if we dealt with poverty. But I'm not king for the day or any other time. So this is, and we have such limited resource.
Right. Well, I do think that in the process of doing this, you know, I mean, that's why I put this slide in. In the process of doing this, yeah, you know, if you look at the efficacy of these programs, there's people who are living in poverty, but they're not as efficacious with people living in poverty as they are with wealthier people. So at some point, I think we have to make the case to the powers that be that we need to make progress on these other things. So, so is this a question that we should be seeking to answer?
I don't think that's a secondary issue for me. It's not the primary issue.
You're on mute.
How long have we been doing this?
Still can't.
I'm not on mute.
I can't hear you.
I can hear you, Dr. Richardson.
Okay. Tony, can you hear me?
Can anyone hear me?
Yes.
Yeah.
We can't see you, but we
Can't
can
see.
hear you. Anybody who's not in agreement with number 2?
I'm not in disagreement. I'm just trying to weave in.
Can you hear me now?
Yeah, I could hear you.
Yes, we can hear and see you now, Tony.
The first bullet deals with systems.
Mhm.
The second bullet deals with programs.
Now say something. Can you still hear me?
Yes.
Well, this is very frustrating.
So who do you use?
Hey, Tony, sign out and come back in. See if that makes a difference.
So Tony can't hear us? Is that what's going on?
I think so.
I think he cannot hear us. So
Okay.
I'll put it in the chat, the suggestion you made, Dr. Richardson.
Well, I no
I'm
longer
gonna
see him.
hang up and come back.
Okay.
Quick question. In theory, if we're going to figure out what systems are currently in place, if we're going to do that work, could a subset of that also be, if there are systems in place, what are there programs that system is overseeing, you know, implementing?
Mhm.
I think the programs are important. And Carolyn, you said it, if people are out there doing good work, it'd be nice to know what they're doing, what program.
Yeah, I'm just trying to put it in my head in terms of how I would work with the community to ask these 2 questions. And so when I'm asking about systems, some of them might interchange that with programs versus a curricula. So I have a system in Warren Springs. Okay, I have a behavioral health program that's supposed to be working together with prevention, our prevention programs, together with our child protective services, together with our community health programs. So that's the system. The system is all the different. However, if someone would say, well, what programs do you have? Guess what they're going to say? Well, I have the behavioral health program. I have the child protective services program. So we need to make sure that we're using the word program. If we're asking what type of maybe curriculums or approaches do you have within a program, then I think it clarifies it. I just want to make sure it's clear. So I understand the first one is system, the second one is program. So when we're asking about programs, there might be interchange with system. You see what I mean? People don't always look at system. That's probably more of a, I don't know, a higher level way of seeing like an organization. So I just want to make sure that if we're going to go out there and start asking these questions, that that people don't stop and saying, what do you mean by program? I just told you what I had. So it's, yeah. So are we looking at actual curriculums or strategies that we have in place?
Yeah.
I think so.
Yes.
I think that there, over the years, there've been a lot of
I know.
interventions for families that didn't have any evidence of their benefit. So I do think we want to know which programs. That's not nearly as much of a problem as it used to be, but I do think we want to ask, well, which program?
Yes. So maybe we can wordsmith if specific family interventions used or something like that, because it sounds like Caroline's issue is she believes the word systems and programs may be used interchangeably and cause confusion.
Okay, so let me take a crack at defining systems as I used it in that first one. And that is something like OPEC or the way in which a county tracks what programs are being provided. And when I use the term program, I mean literally, a program of this sort. Does that help?
Can I jump in? So I think tracking is important, and it is often part of a system. But when you said system, Tony, what I interpreted that to mean was what are the systems in place to actually deliver the programs that we might make specific recommendations around, such as physical, community clinics or community agencies or networks of people that are working at this, that sort of level of system, as opposed to the monitoring. So I think, to Carolyn's point, I wonder if we just need to be better, not just at framing the question, but actually then defining or saying, when we say system, this is what we mean. When we say program, this is what we mean.
Well, an example of a system, which I think is consistent with what you're saying, Jessica, is in Yamhill County, they've developed a system where any agency that comes in contact with a family that looks like it could benefit from an intervention, there's a collection of people who once a week review all of those and make sure that they get whatever they need. So it might be something to deal with an aggressive kid, but it might be something to deal with homelessness, so on. But that's a system that's, I think, increasing the likelihood that families will get what they need. Does that help?
Yeah, I mean, that fits. I think maybe, and I don't know if this was the part of the issue, Carolyn, but system is a very big concept, right? Systems can look a lot of different ways. And so maybe it is a matter of providing some examples to help folks understand, again, what we mean by system.
Yeah. So if I'm hearing correctly, we're in agreement with the question. We're asking that it be worded a little different.
Help reword it. We're talking about this one?
We're talking about both at this time,
Okay.
if I'm understanding correctly. From what I'm hearing from the panel is they would like to expound more upon the word systems so that the reader understands better what we mean by it. And the same is true for programs.
Okay. So how about if you help us, well, so what do we mean by systems? Jessica and I said some things, but give us the words.
Is it really a process?
Well, we're talking about systems that are that enable our communities and counties to reach families.
So maybe we say that the entities that enable what you just said.
shorthand, could I say effective programs?
Okay.
I mean, in the process, we may say we're only interested in the kinds of programs we've been talking about, but while we're at it, we might as well know to what extent each county is dealing with homelessness, is dealing with poverty. Depending on how we go about trying to find this out.
Mm-hmm.
Are we good with that? Okay, so now what about programs? I would say we're referring to evidence-based programs that can prevent substance misuse.
Since you fixed the entities, since you fixed that, you don't have to fix the next one.
Okay.
Because I was just having problems in I could have said what programs are in place to enable our communities and counties and would have totally understood that.
Okay.
But now that it's, what are in my mind is the entities, or if I were to come into, if I was a family needed to come in, what I would have used the word process, but entities is fine.
Okay.
I mean, I want to know what's going to happen to me. What if I come in here with a meth problem, and I would like to walk in and get services, and I would hope that someone has a bigger plan than me, because otherwise I would have done it already. Okay. So that clarifies it. So now programs now to me means what are the individual different type of things that exist inside the communities that's going to help families.
Okay, good. Well, shall we go to what proportion of the families who need any sort of assistance are being reached?
Yes.
I mean, we want to get to 100%. The problem with this question is, what's the
base? Yeah, I'm not sure about that question. How in the world are you going to answer it?
Well, let me ask you this question. Should we be striving to ensure that every family who could benefit is reached?
Pam, it looked like you had something to share.
I was going to say it's all families, and so it's a very big
Well, I've been kicking around this state for a long time, and there's a program here, there's a program there, but never has anyone really gotten serious about, are we reaching all the families that can be reached? And the fact of the matter is, we know that we're not reaching a huge proportion of the families.
Well, that's not what the scope of this this thing is, nor does that what question 3 says. I am less interested in any sort of assistance. That's way too broad.
Okay.
Right. This has to be targeted. I feel it has to be targeted as how it relates to substance misuse.
Think so?
This is probably getting into the weeds, but how do we define who needs programs?
Well, I think it would be families that are at risk to have kids who are going to develop these problems. And we do know a fair amount about what those risk factors are. But you're right. I mean, if I had to, well, just take the issue of child abuse, because we know something about that. There are studies that have been done where they just do a survey of a random sample of families, and they ask them about their disciplinary practices. And if you do that, you will find that a large number, the majority of that when they tell you what practices they use, abuse is included in a large number of those reports, and those families are not being reached. We deal with child abuse by finding out that a child has been abused and doing something about it, when we know that there are many children that are being abused that are never reached. Caroline's going to say something, I think.
I'm not sure the relevancy of this question at this point, because I think what we need to do is focus on what is out there and what is happening. I'm not sure how we would ever answer number 3.
Well, would you think that if we were successful 5 years from now, that there'd be more families in programs?
I would agree that if I witnessed this over the years, the fact that the more we make available and the more people who see success, they're going to want the same thing. I agree with that. I'm just not sure how we're going to focus on bullet number 3, because I'm going to agree with, I don't know who was talking, was that Jessica? It's like, how are we going to know who needs this? I mean, people who need this is not the one who's going to come in. We've proven that over and over and over again.
Right.
So,
Okay,
so
you want to take this question off the list. Is that correct?
I'm not saying that it might not be something that we could bring back. I'm just saying I'm not sure how if we're going to be tasked with doing number 1 and number 2. I think that's relevant. I'm not sure how we could do number 3.
But if I say later, we might deal with this.
Yeah, because
right.
It's a judgment. You know.
Okay.
I wonder if one solution that's a middle ground here, because I think the key issue there is proportion, right? Having some understanding of the full number of folks in need of those services. But if we were instead, if we're going to the trouble of, connecting and asking the question, we could ask about how many families do you serve currently in a year, which might give some sense of the scope, but wouldn't address what are the unmet needs or what proportion of unmet needs, but it would be a step in that direction to understand something about capacity.
Mhm.
So is there a system for tracking how many families were served?
And the question in regards to the number who need preventative programs, this question, and I want to emphasize may, but it may be answered with the SUD inventory that's currently underway, because they are looking at the entire spectrum of substance use disorder or continuum.
Well, I mean, there are also adolescent surveys that ask about family relations that actually predict, would give you an estimate of how families are doing, what proportion of families have problems. But that gets back to the Oregon Healthy Teens Survey, and that's something we hope we're going to make progress on, but we'll see. But you'd also want, all of the risk factors we're talking about are things that, are telling you these are families that are at risk for substance use problems. So let's go on to the next question, okay? And this one is, how successful are families' services in addressing the needs of families? That would be, I think, given this discussion, would be trimmed down to and addressing the needs of families that are at risk to have kids with substance use disorders or that would get involved in substance use. But you may not want to get into judging the effectiveness of services. I think it should be part of it, but that's my science orientation, I suppose.
One of the things that First question, what systems currently exist? I wrote down, how are they tracking those systems and measuring success? And Tony, you just said it, the Oregon Wellness Survey, which is one of the systems in place that they track, they have information on youth, but it is not, it's voluntary. And like my school district, they've only participated once in the last 15 years.
Well, the way in which you said that makes me think you should also be on the committee to try and get the Oregon Healthy Teens Survey done in every school in the state.
I would love that because it makes me furious. Same
here. I developed the Oregon Healthy Teens Survey, so and it's dwindled, but we won't get into that. But you said, restate what you said at the beginning, because I think you sort of covered.
The first question, what systems are in place? And then I wrote down, and how are they tracking those systems, whether or not they're successful? What systems are in place to understand what proportion of families need these programs? How do you, and how do you serve them? How do we know if we don't have any information? This substance use is an issue that you ask people if they need help, the answer is no. And I would argue 1 out of 12 people have a substance use disorder. So a lot of people need help, most families.
Okay. So how are they tracking their success in terms of reaching families? We've reached more families this year than last year. That's good. But also, did it help the families is another aspect of success. And what's the prevalence of families that are dysfunctional in the community? Okay, so in some ways you've kind of tucked that into this and made this the important question. I'm going to take this one off the list then, if that's okay with everybody else.
Mm-hmm.
Yeah. Okay. Oh, our work has just gotten so much easier. So what can be done to create or improve the systems that are needed? I think if you answer the first question and we dig into that and can state what we know, then we can begin to make recommendations. So the answer to that question will follow from the work on the first one. Okay, I'm seeing nods. Nobody's frowning. I'm going to go on. Because then the question becomes, how do we do any of this? I think the first one is, a shot at how we answer that first question. I think you've kind of tucked this one, Pam, into this. In other words, in getting a description of these existing systems, we would learn what they're doing to monitor the well-being of families, the reach to families, and the success of the things that they're doing. Is that? So the third thing on this list is something I thought up, and it actually came from a conversation I had with Reginald, because we were talking about the Oregon Healthy Teens Survey. And I suggested that one way to approach that would be to do a survey of superintendents and principals about the use of the Oregon Healthy Teens Survey, where we would find out why they hated it, why they didn't want to do it, why it's important, or they are interested, and so on and so forth. And in doing that, we get a lay of the land, but we'd also be in contact with people and be in a position where we're listening to them, and we might come back with some recommendations for how the Oregon Healthy Teens Survey or some version of that could be done. You could do the same thing here. You could, as it comes into focus with one of the decisions we made at our monthly meeting, what the lay of the land is with respect to the counties and what they're doing with respect to prevention, then we'd be in a position to find out, okay, so what specifically you're doing with respect to families in the public health system or in some other aspect of county government and so on. Comment on any of that?
So if you recall from the main group meeting, staff and I agreed to take the point on trying to pull together a convening prevention folks in the state to do some of this. So I think we'll have a good sense. We are looking at conducting a symposium in April, and I think we can solicit this information when we pull together prevention folks from around the state to come to our convening. It's going to be virtual. And so we will develop a set of questions that will ask people to address in their presentations about what's happening in prevention in our state. Because frankly, I don't have a good sense of what's happening out there in prevention. We talk about prevention from the lifespan, but even in, what we've been talking about has really been prevention among children and adolescents. But there's this whole other area of prevention. And so I don't have a sense of it at all, what it is. I understand what it was, but I don't have a sense of what it is. So I think we might get to some of that at that convening.
And so that would be the same set of people we would want to ask about not only Oregon Healthy Teens, but about family programs. I think one.
No, I don't think they would be the same people for the Healthy Teens. The Healthy Teens folks, I think the barriers are squarely placed in schools. If schools are going to be the entree for Healthy Teens, we've got to talk to schools
Yes.
about what those barriers are.
Yes. Okay. So, well, but
Can I also suggest, just with that specifically, the people who administer, or the individual in OHA who administers that survey, they have a good perspective too, because they're interacting with the school districts as to why they don't and why they do participate. And Clackamas County this last year, the Clackamas County Prevention Coalition, we went after every single school district and literally handheld them to make sure that they would participate, given that it was online this year. So, but I think OHA would have a good understanding because they put together a one-sheeter that asks very specific questions and the hurdles that they come up against.
yeah, I've talked to them about that, and they admit that if they had more resources, they could romance the schools the way you did at Clackamas County, and give the schools the feedback that would be useful to them, and maybe some help on how they could address, risk factors that were high. But that, so I there's a whole raft of things there. But I want to come back to what you were saying, Reggie, because I think one of the challenges you're going to have on that April meeting is who do we want from the counties? I think we want people in public health, but we probably want some people in schools. I think Caroline suggested that the funding streams are not necessarily to public health for prevention. Is that what you were saying earlier?
What I was making reference to is the fact that some of the dollars, the Addictions and Mental Health Division, dollars went straight to the county and to the tribes. And so we knew every prevention coordinator, we knew who was doing what. Right. Once it went over to the public health, there was a redirection in terms of focusing on more of an environmental approach. And as a result, a lot of folks left the field.
Yes.
And so you're not going to find, you're going to find some new folks who aren't going to even know what the Healthy Teen Survey is. And you're going to have find folks in terms of not even knowing what type of programs are out there that are evidence-based. Right. And so, I mean, a lot has happened since the big change. I think the change happened, what was it, Tony, around 2015?
Yeah.
Yeah, so we're looking at almost 7 years of redirection of a lot of the folks. And then you're going to find a whole angry group out there who's going to they're only going to talk about how they haven't been listened to. And so I'm not really sure what we're going to face there. The only thing I could tell you is the tribes are intact.
Well, so I suspect that what we're going to need to do is define prevention of substance use broadly and ask each county, how are you dealing with each of these facets of prevention? So it'd be families, it'd be schools, it would be community efforts and so on.
Yep.
But I think we're running out of time.
Yes.
What should be our next steps on this? Are we committed to meeting every 2 weeks between the monthly meetings?
That was my goal, and I was hoping this time slot worked for you guys. If so, I would schedule it for every 2 weeks out moving forward. I'm seeing head nods. Awesome.
I will say that I have a once a month meeting, and so the next one would not work for me, but it's typically a good time.
Okay.
So I think we've done some useful work here, but how do we move forward? I would like to convene. Well, how about this? How about if I do some further discussion with the Oregon Parent Education Collaborative and get more information from them, pass that on to you, and possibly invite the 3 people that have been named as key players in that to our next meeting to further help us address these questions.
Sounds like a good idea.
Okay. The other set of players in that are the Oregon Health Authority. And what I would want to find out from the Oregon Health Authority is who in OHA would be relevant to the questions we're seeking answers to. And we might invite them to the same meeting, or we might have them at a different time. Is that, would it be acceptable if it maybe worked with Tori and Reggie to reach out to Oregon Health Authority?
Yeah, there is a child and family unit in OHA that we have connections with that seems like they may be a good place to start. But
Okay.
before we do that, I'd like to solidify these guiding questions further. And so maybe the 3 of us can get together and wordsmith these questions and send it out to the rest of the members to get their feedback, so that when we invite new members, we'll have a better sense of here's what we're actually trying to go after.
Okay.
And I think those guiding questions can be that document.
And the 3 being you, me, and Tori?
Yeah, yes.
Okay, that sounds fine to me. There was one other thing. I thought about inviting OPEC people to become members of this work group, but that's quite a demand on their time, and I'm not sure we need that. So I think we hold off on that at least. So
Okay.
I'll send everybody the edited version of these slides, and then the 3 of us can work on wordsmithing and get it to everybody else. Does that work?
Yeah, and then folks can email us back and forth for their comments on these.
Okay. So in closing, could we do a process check? 30 seconds of how was this meeting for you, good, bad, or indifferent? Let's see. Caroline.
I'm kind of neutral because I'm just frustrated what happened over the years. I'm just glad that we're starting somewhere. So I think I feel good that we're at least addressing prevention. So it's a good start. Mhm.
Okay. Jessica.
Yeah, I generally feel good. I'm still trying to get a handle on the work that we're doing. It still feels a little bit not fully formed yet in my mind, but I feel like I'm closer after our discussion today.
Well, you helped to focus us. Thank you. Pam?
I mean, I'm excited to tackle prevention. I think I shared in our very first meeting, I believe it's the cure to a lot of things, but it's a big lift. And knowing that there was a prevention group in years past, I was able to compile a list that probably has 70 people on there that we have emails and stuff. And so, were we successful when that prevention group was doing their work? And if so, can we bring some of those systems and programs back breathe life into them? So I'm excited.
Awesome.
Dr. Richardson, I've heard you referred to as Reggie, Reginald, and Dr. Richardson, and people refer to me as Dr. Biglin, and I am always like, ugh, just call me Tony. What do you prefer?
Well, that's a much longer story that I'm happy to share with you. I've been Reggie longer than I've ever been Dr. Richardson. And for folks who I work with, they are free to call me Reggie. I start out as Dr. Richardson because it's in deference to my father and to my father-in-law, who grew up during times in which, when they became men, they were referred to as boys. And it's my personal way of trying to pay back the dignity that was lost by those two men who were very instrumental in my life and who I had such great respect for. And despite their age and wisdom, society generally didn't respect them as men. And so that's what being referred to as Dr. Richardson means to me. So that just tells you a little bit of my story, but I'm Reggie. Reggie works well for me. That's fine.
Oh. Well, in this context, thank you, Dr. Richardson.
You're welcome.
Yeah.
Tori.
I thought it was a very awesome meeting. I appreciate everybody participating and pushing back and not being afraid to raise concerns and speaking up when things were confusing, which can be vulnerable, but that's how we get a better product. So I'm grateful.
You steered us nicely, and I appreciate that.
Thank you.
Thank you for your patience and my sloppy approach to some of this, but I think we got a chance of doing something that I've wanted to see happen in this state for so long. Oregon has produced the family interventions that are in use all over the world, and they're not used nearly as much in Oregon as they should be and could have been. So, hey, let's resurrect the prevention system.
Hey everyone, this is Heather. I just wanted to interject quickly. In the chat, Jessica made a very good point of, out of the next 3 possible meeting dates, 2 of them are holidays. November 11th is Veterans Day, and then 25th is Thanksgiving. So I don't know if we would want to maybe suggest some different dates for those.
Yes. Thank you. Thank you, Heather.
Actually, I think if we met next week, then we could go every other week and we'll skip the holidays. I don't know that for a fact. It just kind of came out. If we met,
I think that works. Caroline, I think that actually works.
That's a good idea. Yeah. Well, I will put it out into the stratosphere. If you guys would, as soon as possible, let me know if it does not work for you. and so I can make adjustments, but we're going to try Carolyn's suggestion.
I'm not sure I can get the OPEC people to a meeting next week, but set the meeting and we'll see what we can do.
Okay. Well, we've already taken over an extra 10 minutes of you guys' time. I do appreciate, again, your flexibility and patience. Any other closing remarks from anybody?
Thank you, everybody. I'm out.
Bye-bye.
Thank you, guys.
Thank you.